pneumonia is an inflammatory lung infection with symptoms of fever, cough, and difficulty breathing. During normal respiration, air travels through the lungs to the alveoli or air sacs. Infection with pneumococcal pneumonia causes the alveoli to fill with fluid, obstructing oxygen transfer. This is commonly caused by Streptococcus pneumoniae, also known as pneumococcus.
Every time you breathe in, air travels down the trachea through a series of channels called bronchi and finally reaches little clusters of air sacs called alveoli. There are some 600 million alveoli in the lungs, adding up to a surface area of roughly 75 square meters, the size of a tennis court. These tiny sacs, only 1 cell thick, facilitate a crucial exchange, allowing oxygen from the air we breathe into the bloodstream and clearing out carbon dioxide. Pneumonia wreaks havoc on this exchange. Pneumonia is an infection of the alveoli that causes them to fill with fluid. There are many different kinds of pathogens that can cause pneumonia. The most common ones are viruses or bacteria. These microscopic invaders enter the body via droplets either in the air we breathe or when we touch our eyes, noses, or mouths after touching a contaminated surface. Then, they face the respiratory tract's first line of defense, the mucociliary escalator. The mucociliary escalator consists of mucus that traps invaders and tiny hairs called cilia that carry the mucus toward the mouth, where it can be coughed out. But some of these invaders may get past the mucociliary escalator into the lungs, where they meet the alveoli. Because alveoli serve as critical exchange points between the blood and air from the outside world, they have their own specialized types of white blood cells, or macrophages, which defend against foreign organisms by enveloping and eating them. When pathogens enter the lungs, the macrophages work to destroy them. The immune system releases additional white blood cells in the alveoli to help. As these immune cells fight the pathogens, they generate inflammation and fluid as a byproduct of the inflammation. When this fluid builds up, it makes gas exchange inside the alveoli much more difficult. As the level of carbon dioxide in the bloodstream begins to rise, the body breathes more quickly to try to clear it out and get more oxygen in. This rapid breathing is one of the most common symptoms of pneumonia. The body also tries to force the fluid out of the alveoli through coughing. Determining the cause of pneumonia can be difficult, but once it is established, doctors can prescribe antibiotics, which may include either antibacterial or antiviral treatments. Treatment with antibiotics helps the body get the infection under control. As the pathogen is cleared out, the body gradually expels or absorbs fluid and dead cells. The worst symptoms typically fade out in about a week, though full recovery may take as long as a month. Otherwise healthy adults can often manage pneumonia at home, but for some groups, pneumonia can be a lot more severe, requiring hospitalization and oxygen, artificial ventilation, or other supportive measures while the body fights the infection. Smoking damages the cilia, making them less able to clear even the normal amount of mucus and secretions, let alone the increased volume associated with pneumonia. Genetic and autoimmune disorders can make someone more susceptible to pathogens that can cause pneumonia. Young children and the elderly also have impaired clearance and weaker immune systems. And if someone has viral pneumonia, their risk of bacterial respiratory infection is higher. Many of the deaths from pneumonia are due to lack of access to healthcare. But sometimes, even with appropriate care, the body enters a sustained fight against the infection it can't maintain, activating inflammatory pathways throughout the body, not just in the lungs. This is actually a protective mechanism, but after too long in this state, organs start shutting down, causing shock and sometimes death.
Pneumonia is a serious respiratory infection that can take a toll on your body. But with the right care and guidance, you can recover faster and more completely. In this video, we'll provide you with valuable tips and insights to help you on your journey to recovery. 1. Follow medical advice. First and foremost, always follow your doctor's advice. They will prescribe the appropriate medications and treatment plan tailored to your condition. Completing the full course of antibiotics is crucial to ensure the infection is completely eradicated. 2. Rest and stay hydrated. Pneumonia can be exhausting. Make sure to get plenty of rest, as your body needs extra energy to fight off the infection. Staying well hydrated by drinking lots of water and clear fluids can also aid in recovery. Point 3. Breathing exercises. Breathing exercises and deep breathing can help expand your lung capacity, clear mucus, and improve overall lung function. Your healthcare provider can guide you in performing these exercises. 4. Nutritious diet. A balanced, nutritious diet can play a crucial role in your recovery. Foods rich in vitamins and minerals, such as fruits and vegetables, can boost your immune system. Protein-rich foods aid in muscle repair and recovery. 5. Gradual physical activity. While rest is essential, gradually incorporating light physical activity, as advised by your doctor, can prevent muscle weakness and improve lung function. 6. Monitor your progress. Keep a close eye on your symptoms and follow up with your healthcare provider as scheduled. They will help track your progress and adjust your treatment plan as needed. Recovering from pneumonia may take time, but with dedication and the right approach, you can achieve a full and speedy recovery.
So how can we prevent pneumonia? Eating well and getting enough sleep and exercise helps your body fight off infections. Vaccines can protect against common pneumonia-causing pathogens, while washing your hands regularly helps prevent the spread of these pathogens and protect those most vulnerable to severe pneumonia.
Lung cancer is the second most common cancer worldwide. More people die of lung cancer than colorectal, liver, and breast cancers combined. About half of all lung cancers are diagnosed after it has already metastasized. At this point, chances of survival are extremely low. The 5-year survival rate is only 4%. In contrast, about 1 in 5 lung cancers is diagnosed while in the early stage, where the cancer is relatively small and contained within the lung. The 5-year survival rate here is 63%, highlighting the importance of early diagnosis. Experts estimate that early screening could allow up to 75% of lung cancers to be detected at an earlier, more treatable stage of the disease. The most common symptoms are tied to the basic functions of the lungs and may include 1. Coughing that doesn't go away or gets worse. A lung cancer cough isn't easy to identify by type. What sets it apart from other coughs is how long it lasts. Most coughs caused by other conditions will clear up in a few weeks, but lung cancer coughs are chronic, meaning they last longer than 8 weeks. Many people with lung cancer say their cough just won't go away. 2. Coughing up blood. Hemoptysis can be a warning sign of lung cancer. In fact, it is the only sign present in 30% of people at the time of diagnosis. The blood is often present in small amounts, such as what you would find on a blood-tinged tissue. But any amount of blood sputum should be evaluated carefully by your doctor. 3. Respiratory infections. Many people diagnosed with lung cancer say that their symptoms were first dismissed by themselves, or even their healthcare providers, as being due to a respiratory infection alone. But when lung tumors grow near the airways, they can cause an obstruction that raises the risk of these infections. Repeated infections such as pneumonia and bronchitis are, in fact, common before lung cancer is diagnosed. 4. Spontaneous smoking cessation. It's been found that a significant number of people with lung cancer reduce the number of cigarettes they smoke or spontaneously quit smoking prior to their diagnosis. What's interesting is that very few symptoms of withdrawal occur in most cases. Until recently, this cessation was thought to be related to an attempt to ease coughing or a subconscious fear of developing lung cancer. However, studies now suggest that the ability to stop spontaneously may actually be an early sign of lung cancer. It could be that lung cancers produce chemicals that decrease the addictiveness of nicotine. And 5. Chest pain. Many people mention that they feel chest pain before they are diagnosed with lung cancer. The lungs themselves do not have nerves that sense pain, but pain can be caused by several things, such as the pressure of a tumor on nerves, pain in the ribs from cancer that has spread to the bones, muscle strain or even rib fractures from repeated coughing. Although not everyone with lung cancer develops these symptoms, these are the symptoms most likely to appear before the disease spreads and becomes more serious. So, if you have a bad cough, recurring chest pain, or respiratory infections, see your family doctor.
Immunotherapy treatments for non-small cell lung cancer. Is immunotherapy the right treatment for your non-small cell lung cancer? The first step in finding out is for your doctor to do a complete evaluation. This will include tests to look for genetic changes and for the checkpoint protein PD-L1 in your tumors. Your doctor will also consider other factors, such as the stage of your cancer. This is a way of measuring how much cancer is in your body. And whether you've been treated for non-small cell lung cancer before and what kind of treatment you received. Your doctor will check to see if your tumor has certain genetic changes, such as changes in proteins called EGFR or ALK. If it does, your doctor may recommend that you get targeted therapy first because it will do the best job of shrinking your tumor. Targeted therapy uses drugs to attack abnormal changes in certain genes in the cancer cells. Like immunotherapy, targeted therapy is a kind of precision medicine. Precision medicine means treatment that is tailored to the precise features of your cancer. Your doctor may recommend that you start treatment for advanced non-small cell lung cancer with an immunotherapy drug when your tumor doesn't have the proteins EGFR or ALK. You have not been treated for non-small cell lung cancer before, or when your cancer has spread to other organs. Your doctor may recommend treatment with immunotherapy alone or with immunotherapy plus chemotherapy. Your doctor may recommend treatment with the immunotherapy drug durvalumab when your cancer has spread into the chest or lymph nodes near the lungs but not to other organs. or you have had chemotherapy and radiation treatment and your cancer has not gotten worse. Your doctor may recommend immunotherapy if your cancer has grown or come back after you have had chemotherapy, targeted therapy, or both. Even if your cancer cells don't have the checkpoint protein PD-L1 or have low levels of it, immunotherapy may still work for you after you have received other treatments. Your doctor may recommend that you get both an immunotherapy drug and chemotherapy. Clinical trials are tests to find out if a new cancer treatment is better than existing treatments. Ask your doctor if enrolling in a clinical trial is right for you. Side effects can occur when an immunotherapy drug attacks healthy cells. Common side effects include feeling tired and weak, pain in the muscles, joints, or stomach, loss of appetite, itching, diarrhea, and skin rash. Always talk to your healthcare team about any side effects you are having. Side effects of immunotherapy are often treated with prednisone, a drug that suppresses your immune system. Your immunotherapy will be stopped until the side effects clear up. Immunotherapy treatments for small cell lung cancer. Your doctor will talk with you about whether immunotherapy is an option for your small cell lung cancer. Factors to consider include the stage of your cancer. This is a way of measuring how much cancer is in your body, and whether you've been treated for small cell lung cancer before and what kind of treatment you received. Your doctor may recommend immunotherapy if your cancer has spread widely in one lung, to the other lung, to lymph nodes near the lungs, or from the lungs to other organs. If your cancer has spread in any of these ways, it is called extensive stage small cell lung cancer. If you have extensive stage small cell lung cancer and have not been treated for small cell lung cancer before, your doctor may recommend that you start treatment with a combination of immunotherapy and chemotherapy drugs. If your extensive stage small cell lung cancer has come back after chemotherapy, your doctor may recommend an immunotherapy drug called tarlatamab, a bispecific T-cell engager or BiTE therapy. This kind of immunotherapy links a patient's T-cells to cancer cells so that the immune system attacks the tumor cells. In clinical trials, people who were treated with tarlatamab lived longer than those whose extensive stage small cell lung cancer came back after chemotherapy but did not receive tarlatamab. Durvalumab is an immunotherapy drug that has been used to treat extensive stage small cell lung cancer for several years. It was recently approved to treat limited stage small cell lung cancer that has not gotten worse after treatment with chemotherapy and radiation together. Limited stage small cell lung cancer is cancer in just one side of the chest. It may be in only one lung and sometimes lymph nodes on that side of the chest. Clinical trials are research studies that find out if a new cancer treatment works better than existing treatments. Ask your doctor if enrolling in a clinical trial is right for you. Side effects can occur when an immunotherapy drug attacks healthy cells. Common side effects include feeling tired and weak, pain in the muscles, joints, or stomach, loss of appetite, itching, diarrhea, and skin rash. Serious but treatable side effects from tarlatamab can include breathing problems, low blood pressure, or neurologic problems. You may be observed in the hospital overnight after the first 2 doses. Always talk with your healthcare team about any side effects you are having. Side effects of immunotherapy are often treated with drugs that suppress your immune system. Your immunotherapy will be stopped until the side effects clear up. It's important to discuss all of your treatment options and possible side effects with your healthcare team so you can make decisions that are right for you. If there's anything you don't understand, ask to have it explained.